All right. Um, Welcome back. I know some of you hopefully had a little bit of a break over the summer and ready to get back into the swing of things here. Um, so I always like to highlight, at least for 130, the things that you are responsible for that's new this semester, because everything else is pretty much the same. The difference is um, you have some flow rate questions, which are going to be new for you. And you have what are considered like a complex two-step question, which is going to be new to you. But everything else is the same. So you're going to be doing conversions, milligrams to grams, micrograms to milligrams. You're going to be doing, you're converting pounds to kilograms, ounces to milliliters, teaspoons and tablespoons to milliliters. So those things are consistent and pretty much the same. Then you're going to have some of your oral based medications, capsules, tablets, and then liquids, your parenteral medications, your injectables. So again, typically injected in as milliliters. And so you probably have a pretty good footing on those things, but you can use these practice tests or do some of your own research and find some additional practice questions that will kind of tie into this work, and that way what you're practicing is kind of consistent. And so we'll go over. I'm going to first and foremost focus on reminding you what you need to know, and then diving right into the flow rate type questions, because that's the types of questions that are new, just to kind of show you what those look like, how rounding rules apply with those things, and then go from there. So as a reminder, you're responsible for knowing these conversions. They will not be given to you. You have to know that they're what they are, and be able to reference them and use them off the top of your head. What I find is helpful for a lot of students is just to take those values, write it down several times, and then write it down when it's time to actually do your actual practice, or do your actual test. So just write it down at the top. So it's one less thing you have to think about until you get really confident with knowing what those are. And then, 2 years out of school, you could just forget it all, because you probably won't need it as much. But anyways, um, so let's do a couple things here as a reminder, and I'll clear all this out so you have it as a fresh template when you work on this. As a reminder, when you convert grams to milligrams, milligrams to grams, like you don't round those numbers. When you're just doing your simple metric to metric conversions, you do not round those answers. So like this one, like we'll get an answer of 1.052. That's your answer. Don't round that to 1.1. Okay. Hopefully you remember that from last semester, and that won't be an issue for you. If you ever have any questions on rounding, bring it up during the review, or B, email me and I'll make sure that I get that answered for you. Now, when you do go from the different systems, so if I go from metric to US standard or US standard to metric, then you can, and you might sometimes need to round to the nearest tenth. So if you come across an answer that you're just not 100% certain on, just let me know and I will help navigate that. As an example, like when we are converting pounds to kilograms, you do want to round to the nearest tenth with your final answer, including when you're doing your weight-based calculations later on in the actual like two-step problems two-step problem that I'll show you in a little bit. Rounding really comes into play when you're doing like going from outside of the metric system, like pounds to kilograms, or going into the metric system from outside the metric system, or when you're doing like your oral and your injectable calculations, because you can't give somebody like a multiple decimal answer. You're going to give them 2.5 milliliters, not 2.454545. You're going to round that to the nearest tenth, and then that makes life a lot easier for you as a nursing student and even as a nurse when you're doing your injectables. So let's go into the flow rate questions. And we'll start with, not that one. Start with this one. Okay. So what I'm going to do is, and if one of the things that I like to do is I'll actually go in and I'll change these numbers up. So that way you are getting a little bit of a different review as opposed to what I did already in the spring. So if you want to see like what was originally here, you could see it in the spring, and then the spring reviews, and then but I'll use the same kind of templates just to kind of give you an idea of, some questions to practice and then create some variety. And then this is how the questions are even made when you're doing some of these things. So I'm going to start off with some of the simple ones, and then we'll get into the more complex ones with the drop rate. While I'm clearing these things out, one of the things that we're going to what's going to be okay, one of the things that we're going to want to pay attention to is, what is flow rate? What does that mean? What is drop rate? What does that mean? And what are the variables to calculate? So I'm going to start off with these like 17, 18, 19, this kind of like the standard flow rate type questions, where what we're looking for is we want to know how much to plug into the infusion pump to make sure we're administering the medication at the correct rate and speed in which it needs to be coming in. And so a lot of times it gets a little bit challenging in that there's sometimes extra information that you don't necessarily need to calculate what you're looking for. So let me give, I'm just going to create a different variation. Let's say this is 375. Let's say this is 30 minutes. And then it tells me to calculate the flow rate in milliliters per hour. Okay. So what I'm going to do is, in order to calculate flow rate, I need two things. I need volume in milliliters, and I need time in hours. You'll see that you have your volume and that you have your time, but the time here is written as minutes. So you either need to convert minutes to hours, which I'll show you how to do, or just convert it before you plug it into your calculation. So if you're looking at that and go like, okay, I know that's half an hour or 0.5, that works perfectly well too. Now, if you instinctively you're like thinking, okay, I want to do a calculation of, or I want to what I wanted to say. Oh shoot, never mind. I lost track of what I wanted to say. But sometimes you could just kind of figure this stuff out in your head. You can be like, okay, well, it's 375 and 30. 375 times 2 will give me what it would be in 1 hour. And then you're like, okay, it's 750 milliliters per hour. And then you're good to go. But if you don't feel confident doing that, there are other ways to get the answers. And I'm going to show you how to do that. Oh, I remember what I was going to say and then forgot. If you are solely stuck on doing ordered over available for everything, the flow rate stuff doesn't work very well for ordered over available. Okay. Really, you're not doing much of anything other than some conversions, which is where dimensional analysis comes into play. But more importantly, just knowing how to convert minutes to hours, so you can do conversions without dimensional analysis. But I just want you to know that if you're trying to do order available with flow rate type questions, it's you're going to be going like uphill trying to solve it, as opposed to kind of just keeping it linear. And I'll try and give you some examples of that so you can not have any more challenges than what is necessary. So the traditional way that I would set this up is I would tell you, take your 375 milliliters over your time, and then just convert the time to hours. Okay. And you should know that, there's 60 minutes in an hour, and then you're just making that conversion. You would plug it into your calculator. So I would take 375 times 60 divided by 30, and you're going to get, like I said earlier, 750 milliliters per hour. Alternatively, you can take your volume and divide it by the 0.5 or 1/2 hour, however you feel comfortable writing that out. And then all you do is take 375 divided by 0.5, and you get the same answer. Okay. It doesn't change the answer. It's just a different way of setting up the same thing. I would highly recommend doing it this way because it's good practice for when things get a little bit more challenging, or you don't have like 0.5 hours. Like, what if it said 372 milliliters in 42 minutes? Then it's going to be very challenging to calculate what 42 minutes is as a decimal hour. So just get in the habit of practicing and make sure you're making your conversions going from minutes to hours. Let's look at another example. Number 19. So I am skipping around intentionally because I didn't put these in the order that I would prefer them to be in, but I'm trying to keep it like I'm trying to step. Okay. So in order to change it from what it was to what it is now, let's just say it's 500 milliliters, 3 hours. What would you set the infusion rate to? Okay. So what is flow rate? It's milliliters per hour. What are my milliliters? 500. What are my hours? 3. So I don't need to do any conversions. It's already in hours. I don't need to convert anything from hours to minutes or minutes to hours. It's exactly where we want it to be. All I need to do is take my calculator out, take 500 divided by 3, and I'm going to get some awful looking number that looks like 1.66, and then it's like 667. Just keeps repeating. Okay. So it's just a repeating number. So what I've been shown to do, at least from the standpoint of dosage calculation, the drug calc kind of setup, is to take that number and round it to the nearest tenth. So I would say this would be 166.7 milliliters per hour. Now, some of your instructors might want you just to do it to the nearest whole number and tell you it's 167 milliliters per hour. Sometimes you'll learn from a clinical standpoint that you would just put that at 165 or 170. There's a lot of variation in that from a clinical standpoint, but if we're following the dosage calc rules, and until I'm told differently, I would highly recommend that you at least round it to the nearest tenth, because you can give somebody a tenth of a milliliter. You just may not be able to set that on your infusion pump. You may not be able to set it to the nearest tenth on the infusion pump, which is why I'm saying that there's a difference from a clinical perspective. All right. Most likely what you'll see on your test, it'll be more like 600 milliliters over 3 hours, and then it's 200 milliliters per hour, and it's just a nice even number. But sometimes I like to give you these ones to make you like think about like, oh, okay, does that set up correctly? Does that math make sense? And then what do I do from a rounding perspective? That way you can kind of see how I go through my thought process when it comes to rounding. And you can see there's another example of that same type of question right here. I'll leave that for you to do on your own. Let's make this, I'm just gonna say 700 milliliters, and then we'll say 4 hours. Okay. Another variation that you might see associated with these questions is it might give you the flow rate, it might give you the total volume, and then it'll ask you to calculate how long the infusion will take. Now, normally what they're looking for is how many hours or even how many hours, minutes it would take. So here they use 1.5 liters. Let's just change this up. Let's just say it's 1 liter IV, infusing at, let's just say 125 milliliters per hour. So that way it gives us a different variation of this. How long will the infusion take? So again, I'm going to show you something that if you're doing ordered or available, you might be able to get it to work as long as you keep things kind of organized. But it can also be a little bit tricky because there's a lot of like common units. So the first thing is you need to convert liters to milliliters. So you already know that 1 liter is 1,000 milliliters. So just make sure, you know, you got that. I'm confident that you know how to do that conversion. Then that's kind of like your ordered. Your available is going to be the volume over the time. And so what I'm going to tell you to do is what we're looking for when it says how long, that means, you know, how many hours, okay? Or how many hours, minutes, okay? So what I'm going to do is I'm going to get rid of milliliters and convert it to hours, and I'm going to do so using the infusion rate. 125 milliliters, 1 hour. If I was writing this up like a ordered over available setup, it would look like this. Okay. The problem is the available doesn't make sense because it's not necessarily available. It's just, it is the infusion rate, but the math still works out. So if that's the way your mind works and that makes sense to you, just make sure you always put the volume that's in the IV bag as your order, and then your available would be the infusion rate. And if you don't want to do it that way, then all I'm doing here is a conversion. And as always, if you've worked with me in the past, you know that I like to set these up like this because that makes it so that the time is, or it makes it so I know that I'm eliminating the units that I don't want and I'm left with the unit I do want. So I'm just going to take my 1,000 divided by 125. I think that's 8. Yeah, which is 8 hours. Now, sometimes they'll ask an additional question, and I can't remember if I have an example of it on here, but they'll ask like, okay, let's say it started at 8:30 a.m. on a Tuesday. It's infusing, you calculate, you know, that it's 8 hours. What time will it end? And so basically you would just start at, you know, 8:30 a.m. using military time, so 08:30, and you would just add the 8 hours to that. You would get 08:30 plus 8 is 16:30. So it would be done at 4:30 in the afternoon, still on Tuesday, or 16:30 hours. Okay. Still on Tuesday. You might see that question. I don't know. I feel like that has been a question in the past. It sometimes crops up, but I don't know that you'll actually see it. So that's why I'm like talking the way I'm talking, saying like I don't necessarily know that you need to worry about it. All right, let's see what else we got here. All right, so those are the flow rate type questions. When we introduce drop rate questions, now we're going to add an extra component that is basically, instead of talking about just flow rate by itself, now we have a drop rate, and the drop rate is drops per minute. The way to think about this is kind of like an IV piggyback where you have a separate IV solution of a medication, might be antibiotic, might be heparin, might be insulin, and it's being introduced and added in a drop-like fashion to the normal saline solution that's being there. So it's kind of dripping in. So I always think, like, if you ever see, like, if you have, obviously you've seen it in a hospital setting, but if you see it like on like a medical drama or TV show where they have like somebody and they're getting that like morphine drip or whatever that's what's going on there, or their nitro drip or whatever that is, like you'll just see it kind of dripping there into like the IV solution. That's essentially what we're calculating. We're trying to add little bits and little drops of a solution containing a medication to be administered to the patient outside of just doing a bolus dose, right? Injecting into a port and doing a bolus dose, which you certainly can do as well. This is more of a titrated over time type of dose, which is why we're calculating a rate. So when we calculate a flow rate or a drop rate, we need to know a couple pieces of information. We need to know the flow rate. We need to know the drop factor. And we need to know that that equals our drop rate. So I need two pieces of information to get my drop rate. We don't need to make it any more complicated than that. Our flow rate is going to be just like we've been learning, or what I've just been reviewing. It's going to be volume over time, but it might be written as milliliters per minute. Okay. So technically a flow rate is volume over time. The infusion pumps are typically going to be in milliliters per hour, and then your drop rates are typically going to be drops per minute. Okay. So knowing that milliliters per minute is an acceptable thing to utilize is just there to kind of be helpful for you. Our drop factor will always be given to us, and it's drops per milliliter. And then our drop rate is drops per minute. Okay. Now you might be saying, what is this GTT nonsense? Why are you writing GTT and then tell me it's a drop? Well, GTT is the abbreviation for drop, because the abbreviation, or what's the abbreviation DR is actually the abbreviation for DROMS. So if you have like some cologne or perfume sitting at your house, if you look at the bottle and you look at the measurements, sometimes that's where you'll see, like, it's 1 dram, which is however many milliliters. So dram is an apothecary unit that's no longer utilized in standard medicine. You might see references to it in older textbooks and older books and things like that, but they're pretty much just adopted the metric system and following those things. Drops are still a system of unit of measurement. It's become standardized. And you might be wondering, like, where is this 15 and 20 and 25 and all these different variations? Where does it actually come from? It's based off of the tubing. So the tubing has different diameters, and then those diameters are what dictate how many drops per milliliter come out, which is why it has to be told to you. However, if you're on ATI or taking the NCLEX, and you get, you're supposed to be calculating a drop factor, and you get something like microtubing. Microtubing is a standard, and it's 60 drops per milliliter. So that's probably the only scenario I can think of where you would need to know that piece of information to where it doesn't give you the actual drop factor. But I don't know how often that occurs, if it occurs at all. All right, so let's do this problem, but let me change up some of the variables. So let's make this 275, and let's make this 25 minutes. All right. So this tells me that we're supposed to give somebody, this just says a dextrose solution. So there probably is a medication here because it says 125 milligrams. So usually 125 milligrams of some sort of medication in the dextrose 5% IV solution. So you might see variations of this question where they're using an actual like name of a med, like gentamicin or something along those lines. And then it says the solution is 275 milliliters in 25 minutes, and then they calculate the flow rate in drops per minute with the given drop rate listed. So when you're looking to see what is your drop rate, you'll see it written here on the label where it says 15 drops per milliliter. And then again, the abbreviation for drops is GTT. All right. So I'm looking at this and I'm sitting there going, okay, where do I start? So I'm going to start with flow rate. What is my flow rate? I need volume and I need time. What is the volume I have? 275 milliliters. What is the time I have? 25 minutes. You also will notice that you have 125 milligrams. The 125 milligrams is important because we want to make sure we're administering the correct medication and quantity of medication to the patient. But as far as calculating the flow rate, it doesn't matter. And what I mean by that is, let's say we're driving to Kennywood, I'm in my minivan and you're in your Cybertruck. Okay. You're not going to go any, we both have to cover the same distance when we're probably both going to be traveling around the same rate of speed. So if you're going there at 40 miles per hour in your Cybertruck, I'm going there at 40 miles per hour in my minivan. The rate of speed is what is important. Okay. It doesn't really matter what we're driving. Same thing goes for when we're talking about flow rates. We really don't care about what the medication is, other than obviously you want to make sure in a clinical setting that you're giving the patient the correct medication. What you care about, is setting the flow rate appropriately. Okay. And then in this instance, we just need to know volume over time and then multiply by the drop factor. So some of these questions, you will see extra information, which is why it was written there, because you will see a version of that or example of that on the test. And I just like to keep it very, very simple for you. All right. So my flow rate in this scenario is 275 milliliters, 25 minutes. I am not going to convert minutes to hours. The reason being is because my final answer is already in minutes. So I don't want to convert it to hours and then convert it back to minutes. If it's in minutes, leave it as minutes. Then I'm going to multiply by the drop factor, which is 15 drops per milliliter. And we're going to see what we get. So I have 275 times 15 divided by 25. And in this scenario, I'm actually going to get a pretty large number of 165 drops per minute. Now, something you need to know is you always have to give them a whole drop. You can't give somebody a partial drop. It's either they get a drop or they don't get a drop. There's no half drop. There's no 0.25 drop. It's a whole number. So if you got an answer of like 24.45, okay, you would just say 24 drops. If you did round to the nearest 10th and then argue like, is it 25? I would say don't do that. Look at the whole number when rounding. So if it's 24.45, then it's 24 drops. And I think there's an example of that here, which we'll get to in a minute. All right, so let's look at some of the other examples here. Here's another one. So I'll leave the drop factor at 10. Let's say this is 250, and let's say it's 3 hours. So I'm trying to make this a question that'll give us a little bit more of a challenge. So again, what's my flow rate? It's 250 milliliters. And then it's 3 hours. Now, I'm going to challenge you because you know you're going to be calculating for minutes anyways. I would just say when you're doing drop rate questions, right off the bat, convert hours to minutes. You can set this up dimensional analysis, so I'll show you that way. Or you can just go right to putting the minutes at the bottom, but I'll show you the kind of like the longer way first. So 250 milliliters, 3 hours, times your flow rate, or your drop factor, I'm sorry, which is 10. Your milliliters are gone, which is good, but you're in drops per hour. So before you do any calculations, you need to convert hours to minutes. Now, sometimes students get hung up on, do I multiply by 60? Do I divide by 60? When you use dimensional analysis, it takes that out of the equation because you're just matching up to eliminate units, and it helps to kind of organize the material if you're ever getting stuck. Okay. So I'm going to take 250 and we'll multiply across the top times 10. I'm going to get 2,500. I just leave it in my calculator. I'm going to divide by 3 and I'm going to divide by 60. And I'm going to get 13.88 repeating. So I'll just put 8 and I'll put a line over top of it. And I already told you we can't do anything with that we can't do anything with the decimals. We don't round to the nearest tenth. We're talking about drops. So what I need to do is round that to the nearest whole drop. So I'm going to look at the 8. So I'm going to round that to 14 drops per minute as your answer. Do not write 13.9. You will get that wrong if you even have a question where there are decimals involved. You probably won't, but if you see it, now you know. The alternative way for solving this is, what's 60 times 3, or even 6 times 3? Okay, 18, so 180 minutes times 10. This is what I was saying. So you can skip a step and make this a little bit easier for you, and you're still going to get the same answer. So anyways, those are your flow rate questions. Those are the questions that are relatively, or that are newer for you this semester. And hopefully now that you're seeing it, you'll be able to crush them without issues. And like I said, I have plenty of samples that I've done over the years. I've done individual questions on YouTube. You might just have to look for them a little bit. And if you need me to point out where some of these things are, let me know and I'll try and do that for you. I want to see if I have that 2-step question for you. That way you have an idea of what that looks like. Here we go. So these are 2 examples of 2-step questions. This second one you probably won't be getting, but I left it on there. You will get something that looks like this. This number 24. So let me work that out for you. I'm going to change the information a little bit for you. All right. So question 24 is basically an example of a 2-step problem. What are the 2 steps? Well, step 1 is you're converting pounds to kilograms. And then step 2 is, solve for milligrams in this particular example. I'm actually, you know what I'm going to do? I'm going to say, no, we'll just leave it at that. Sometimes like you'll get your milligrams, and then you can calculate based off of the available medication, meaning like, let's say the medication was, 50 milligrams per 2 ml for whatever it happens to be. Well, here, actually, I will add that in there. So I'll just write available Dilantin 125 milligrams per liter. So for the loading dose, how many milliliters would you administer to a patient who weighs 127 pounds? So again, solve for milliliters. Okay. So step 1, I'm going to convert pounds to kilograms. Normally, I don't write anything more than just how I do that. So I'm going to take my 127 pounds, divide by 2.2, and then that's going to give me my patient's weight in kilograms. So 127 divided by 2.2. And I'm going to get 57.72 repeating. So it just keeps doing that. We're going to round that to the nearest 10th. So 57.7 kilograms. Okay. So again, I'm trying to show you and model when you do your rounding. All right. Now I'm going to take that 57.2 kilograms, and I'm going to multiply it by the loading dose, the 7.5 milligrams per kilogram. What that's going to do is eliminate kilograms and give me a milligram strength. So 57.7. Sorry, that's supposed to be 7, not 2. Sorry. So 57.7 times 7.5. I'm going to get 432.75. Okay. Then, if you are a big fan of doing ordered over available, now you can do that. Now I can take my order, which is the 432.75 milligrams, over my available, which I told you is the 125 milligrams per milliliter. So 432.75 divided by 125, and I'm going to get 3.462. So I'm just going to write that whole number out. 3.462. And I'm going to round that to 3.5 milliliters, because we're going to round that to the nearest 10th. So again, when you're looking at this question, I added a little bit of complexity. I added an available. That way you can actually get something that's calculated. The original way was just getting to the 432.75 milligrams. If that's all it was looking for was milligrams, then you would just say your answer would be 432.8 milligrams. You could just round to the nearest 10th as far as that's concerned. Typically, some instructors and some pathways will tell you to save your rounding to the end, especially when you're converting pounds to kilograms. So far, it's been the situation that if you don't do that, it still comes out with the same answer. But if you ever want to just kind of double check, all you do is plug in the 127 divided by 2.2, take whatever that number is in your calculator, multiply by 7.5, divide by 125, and then you should get around the same answer after you round that 3.5 milliliters. Okay. All right. So those are the new types of questions that you'll see. So we have about 15 minutes left. Are there any questions you have on previous material, anything that you want to see? That's, on some of the practice sets that you have access to. If you do have a question, just type it into the chat. If you're good, we can stop here. And like I said, I'll be back on at 3:45 with you guys. I'll leave it up to you. Yeah, this practice sheet is found where all the practice sheets are found on the one shared folder. So if you go to the OneDrive share folder, it says Dr. Rad's practice tests or practice material. Go to Allegheny Campus 130, and then it's right there. There's a whole bunch of them in there. And then this one, the one I'm working on here, I changed it up a little bit from the 24 spring version. I renamed it 24 fall because I'm adding to it. I will continue to add and change and update for all the 4 130 sessions that I'm doing. So if you might see and get a version of this that's different than what I originally went through, I'm going to try and leave them as they are, and then just add to what I've started here. That way, so like I can just copy paste this question and change out some of the wording, but I'll probably just rework some of these since I know I changed them. Yeah, so this is the 222:30 session is not until 1:15. But yeah, they're all the different nursing sections kind of build on one another. But when we get to 222:30, you have the heparin protocol, which is the new big thing that's different. So, but if you're looking for output 222:30, that review is in a half an hour.